Hi. So in this vlog, I often talk about mental health services. Today, I'm going to talk about something that sounds the same, but is actually completely different. Public mental health. And it's an important topic because without it, we are guaranteed to fail in our efforts to improve mental health population-wide. So let me explain. Lately, we've seen an increasing push to align our thinking about mental health care with the way that we treat physical health care. Why? Because nobody's too satisfied with how our society is dealing with mental health right now. In North America, Europe, Australia, and other developed nations, we have about the highest standard of living that human beings have ever been able to achieve. But mental health problems appear to be more common than ever. If economy and culture are machines for the production of happiness, at least in part, then it's pretty clear they're not working so well. So, over to physical health care. In 1900, the average life expectancy in the US was about 47 years. Today, it's about 78.7 years. That's about 30 extra years of life. How'd that happen? It's tempting to say that it's the result of healthcare. If you get sick, you can go see a doctor. If you have appendicitis, you can get your appendix out. If you have a bacterial infection, you can take an antibiotic. If you have a cardiac artery blockage, you can get a stent or a bypass. And that's correct. All those things have helped. A little. But if you add up all the bits of added life expectancy from acute care or individual care medicine, they don't account for most of the increase in life expectancy. So what does? Public health. Now, public health is the completely unglamorous side field that we tend to forget about every time we think about healthcare. But most estimates suggest that the gains in life expectancy we've seen are far more the result of public health than individual health. It might seem a little unclear what the distinction is. What we usually think of as healthcare is treatment, usually once a health problem has come about at the individual level. If you break a leg, you go to the doctor, she puts it in a cast. Public health is focused at the population-wide level and is most often about the prevention of health problems from developing in the first place. So, I ski. Just about every day, somebody breaks a leg on the mountain, and they get treated by the health unit in the village. That's acute healthcare. What's public healthcare on a ski hill look like? Well, it's fencing and signage around hazards. It's foam pads around the base of the lift pylons. It's the brakes on skis so that they don't become runaways when they fall off. It's the ski patrol asking people to slow down. It's a completely different level of intervention. What's public health society-wide? Safety programs, education about hazards, swimming lessons, vaccination programs, replacing lead pipes and lead paint, clearing asbestos from homes, food inspection programs, smoking education campaigns. And these kinds of interventions have done more to enhance life expectancy, and I would argue life satisfaction, than all the chemotherapy and all the MRIs in existence. Okay, back to mental health. I've said this before, but people often think the solution to the mental health crisis is to increase access to treatment, hire more psychologists, write more prescriptions, get more people into therapy. Well, some of that's great. I run a psychotherapy clinic, and I believe in that work. But there's no way that's going to solve the mental health problem. Why not? Because that's not what it's for. The mental health system is designed to deal with mental health problems that already exist. It's not designed to prevent them from occurring in the first place. That's the role of public health, or more precisely, public mental health. And that's not a term you hear very often. Why not? Because it doesn't really exist as a coherent field. But it should, and it'll have to, if we really want to cut down on the number of mental health problems that we're seeing. If a community wants to reduce the number of highway injuries, they can't just increase the number of surgeons in the emergency rooms. They have to look at the accidents and see what's causing them and work on those causes. If a ski hill wants to reduce their number of injuries, they have to look at the injuries they're having and figure out the factors that contribute. In order to effectively address public mental health, we have to know the risk factors for the most common mental health problems. And in fact, the research on this isn't so bad. A lot of the science has been done, but we need to apply that science in order to get the payoff. I was doing some work in a First Nations community in British Columbia, and they'd had a significant problem with adolescent suicide. Part of the issue is that there really wasn't much for the kids to do in the community. A person I was talking to was very, very focused on the idea of beefing up the mental health service. Well, that was good. They needed it. But I suggested that if someone ever gave them $2 million, and for that they could have either a community center or a mental health facility, they should probably go with the community center. Someplace where they could get the young people in the community involved, playing sports, learning things, and where the elders could pass along their knowledge and, more important, their skills to build the resourcefulness of the adolescents. When I was in New Zealand, one of the participants was a psychologist, but also a city councillor. And her community had an issue about what to do with oceanfront land that it had gotten access to, I think from a railway that had gone. One option was to build a picket fence of high-rises. Another was to retain it as public recreational space and parkland with a seawall and a walkway. And she was suggesting that the second idea worked with another priority the city had, which was to improve the physical and mental health of the community. I agreed. You'd want to do the research, but access to nature and recreational opportunities is pretty clearly tied to better fitness and better mental health overall. And that points to something. People might think that by advocating for better public mental health, I'm job finding for psychologists. Well, probably not. Most psychologists aren't trained in public mental health any more than orthopedic surgeons are trained in preventing car accidents. Good public mental health isn't going to directly benefit me. If anything, it might reduce the number of people who are looking for therapy. But it would involve changing the way we think about our culture. If it is a machine for the production of happiness and health and life satisfaction, even in part, then we would have to look at the factors associated with those outcomes. Poverty reduction, public space and recreational facilities, a clean and unpolluted environment, some degree of income equality, not everybody making the same amount of money, but not where the top 1% control more than 50% of the financial assets either. A system where getting sick doesn't bankrupt you. Decent educational systems, integrated neighborhoods, the distribution of privilege, building our communities and countries, not for the sole benefit of developers or huge corporations, but for the culture as a whole. And you can see the problem. The structural changes that we might need to make could be immense. And the people with the most sway may be those most resistant to some of the changes. Even if that weren't the case, it might involve so much effort that it's far easier to avoid and to make symbolic moves. We'll have the odd wellness class in the employee cafeteria. We'll say yoga's a good thing, and we'll increase funding for therapy from 5 sessions a year to 10. We'll cover the cost of antidepressants. But let's not kid ourselves. That is not going to reduce the mental health problem, at least not society-wide, because that's not what any of those measures is designed to do. Sure, we need mental health services, but the lack of them is not what's causing this problem. We don't need 21st century thinking. We need the thinking of 1900, when we began testing water and inspecting food and developing preventive measures that nearly doubled human life expectancy. We need public mental health, and we need to design our society with mental health in mind. If you like videos like this one, press subscribe.